Before we look at the evidence-based approach, let's take a look at how decisions are often made in some public health settings. Often, decisions are sometimes made with the interest of only a few people in mind. For example, decisions are sometimes made based on anecdotal or circumstantial evidence. In other words, the decision feels right. Also, since public health organizations work for the good of society, news reports may affect the direction of some programs. The same can be said for political pressure. Evidence does not always directly lead to the final decision. Decision-making is a political process. The political influence may be implicit or explicit. Sometimes, decisions are made based on history, or the feeling that we've always done it this way, or we've come this far. Even in the most prosperous of times, decisions are sometimes made on the basis of saving money, even if the decision hurts the progress of some programs. Finally, some decisions may be based partly on scientific evidence and partly on anecdotal evidence. Does this sound at all like your organization? In reality, your decision-making will probably fall somewhere between purely scientific and purely anecdotal. Let's look further to see if these are effective ways to make decisions about our public health programs. When we base our programming decisions on gut feelings and political motivations, the programs suffer. Policies fail if we choose an ineffective intervention approach. We need data that supports our decision to choose one approach over the other. Even when choosing the correct approach, if we do not implement the program effectively, there is a chance the program will fail. Part of this means that we need to be sure that we are reaching the right audience. Even if the program is implemented successfully, we still need to be sure we evaluate the effectiveness of the program. We need to make sure the program does not have limited generalizability. An example of this is selecting an intervention that worked with white, middle-class people in suburban Boston and implementing it in rural South Carolina without making any modifications for the local conditions would probably not be appropriate. As you can see, there are many pitfalls on the road to program implementation. These are just a few reasons why some programs or policies fail.